Welcome back to Dr. Sellers Educate. We're happy that you're back to continue to support you on your journey towards CNE success, or perhaps you are here because you want to move forward to recertify with NLN. Whatever the reason you are here, we are happy to support you as you move forward with your plan. Okay, so we're going to talk a little bit about your 7-week study plan today. We know that sometimes 7 weeks can extend to 10 or 12 weeks. The most important step is that you have a clear plan as you move forward towards achieving success, okay? And if you're renewing your CNE, then you also want to have a clear plan because there are specific requirements that are outlined on nln.org website. If you haven't already, go ahead and subscribe to this YouTube channel as well as click the bell button, okay? That's going to make sure that you are notified every single time a new episode is released, which usually happens every single week. Now, if this is the first time you are tuning into our channel, just a few housekeeping tips. First, you're going to see in the description a lot of information that's going to help you move forward on your journey, okay? And then second, one of those resources you're going to see is Billings and Halstead Teaching and Nursing. We call that our Bible when it comes to what strategies we need to incorporate in our everyday work to ensure we are achieving nurse educator excellence. We are very excited when we learn that our nurse educator colleagues have been successful on the CNE exam. And we're even more excited when we hear from you all that you have incorporated just one of these evidence-based teaching strategies or evaluation strategies that we talk about during our episodes every single week. All right, so number one is to go ahead and print out your study worksheet. That is also located right here in the description. You want to print that out every single time you show up for an episode, okay? You want to write down the date, so whatever date you're watching this episode, and then write down at least one learning objective. Why are you here? What information do you want to take away from our time together today? The second resource you want to pull out is Billings and Halstead Teaching and Nursing 6th edition. Okay, you're going to turn over into chapter 16. This is where you're going to find a lot of information about active learning strategies. We're going to start and really extend our conversation in this episode. We started in the previous episode looking at clinical faculty evaluation. How do we evaluate and really validate that students have learned and fully comprehended the concepts that we have taught them? We know at the clinical setting at level, that is where we are expecting our nursing students to be able to apply and analyze and ultimately achieve that higher level thinking where they're able to make clinical decisions about the very best care that our patients should receive. Okay, so we want them to incorporate evidence-based practice into their clinical decision making. All right, so now let's go ahead and tune into our content for our episode. If you have not had a chance to print out your study worksheet, that's okay. All right, you can pause this episode at any time if you're watching this as a replay. If you're watching this when it is launched live, then you can also come back and watch this later to make sure that you have closed your knowledge gaps. All right, so retention. All right, so that's going to be a focus as we jump into our content for today. First of all, did you know only 5% of information that we review in a lecture format is retained by the average learner? Okay, you may wonder, where did that data come from? That's a great question, and we're going to be talking about that. So 5% retention, that is not where we want to be. So how do we increase retention? Well, one key step in that process is increasing engagement. All right, so let's talk about that. How do we better engage our students in the learning process? Let's take a look on page 289 in Billings and Halstead. You're going to see under lecture section, it tells us that a lecture is, the intention is that it will help bridge verbal communication with written information. Okay, this is going to allow students to have a better comprehension of these concepts in order for them to be ready to apply them in the clinical setting. Okay, so let's take a look as we jump into our content and look at the thought-provoking question for this snapshot. So which strategy will the nurse educator use to teach a group of adult learners? A, develop learning experiences that build on previous experiences and learning. B, provide highly structured learning activities that include individualization of learning. C, avoid the use of teaching strategies that foster reflective practice. Or D, minimize learner participation when identifying individual learning needs. All right, so let's talk a little bit about this question before we move forward. When you get to all of your questions on the C and E, I want you to consider two things. Okay, so the first thing I want you to consider is ask yourself, what exactly is this question asking? We know that some of the questions on C and E can be broken up into what we call a three-part question. So there's a STEM, then there is a scenario, and then there's a question. Okay, so think about, what exactly is this question asking me? The second consideration we want you to think about is, what is it that I know for sure about the content that is included in this question? Hopefully, this will lead you at least to narrow it down to two choices, and then we have to decide which one is the absolute best option. Okay, and know that whenever you exit the C&E exam, you will receive your scoring report at that time. We do hear a lot of questions around the NLN SAE or self-assessment exam. Our recommendation aligns with what NLN shares. First of all, there's no correlation between how you perform on that self-assessment exam and how you actually perform on the C&E, okay? We have found that nurse educator colleagues that we support that have a high level of test anxiety do tend to find more comfort in going through the SAE, okay? So you want to consider purchasing the SAE if that's where you are right now. And if you want additional practice questions to help you just get a little bit more comfortable with taking exam questions on a computer, then you might want to consider the SAE. Right now, I would say it's 60-40. About 60% of nurse educator colleagues feel that it's helpful, 40% not so much. But again, that's going to be an individual decision. What we like to provide here at Dr. Sellers Educate are truly thought-provoking questions, okay? And we want to help you work through some test-taking strategies to help you feel more confident when you sit for the exam, and our content review helps you be more competent related to the content that you can expect to see on the exam. All right, so now let's go back to the content that we're going to go through, and then we'll come back to this question before we wrap up at the end of our time together for this snapshot. Next, let's take a look at the data. In case you were wondering, where in the world did we get the 5% retention from? Well, this is a model that was published in 2000, and even current research shows about the same percentage for retention rates. What you also notice in looking at this model is that it is aligned with the VARC framework, okay? When you see here, these two color-coded areas, it indicates that those learners who report as being kinesthetic and visual, that it aligns and connects with those type of learners in our classroom setting. So when we lecture, this research says that only 5% of the information is retained, okay? And that is not ideal. That is not where we want to be. But this is valuable information for two reasons. First of all, when we think about developing our lecture, we want to consider, what are our learning objectives? Okay, so what is it that we want our students to learn? How are we mapping the content that we're covering in the lecture to the actual assignments that students have for the course for that specific week, right? So we want to ensure there's alignment. The second consideration is, what other activities can we engage students in so they are an active participant in their learning process? Okay, so we are teaching adult learners, and we're really facilitating the learning process. But we know there are adults that show up in our classroom. We want to leverage the advanced knowledge that they bring into our classroom. They bring life experiences into our classroom. They bring clinical experiences once our students get started. So we want to leverage that information to empower them. So we want to invite them into discussions, just like this retention model says. We want to ask them questions about their clinical experiences, and we want it to be relevant. And we also want to consider pre-class assignments. That is one of the components for a flipped classroom. When we take a look on page 289, what else do we know about lectures? Well, there are some teaching tips that are listed. Like we already shared, we want to add activities to the lecture that stimulates our learners. One common question we get is, well, should we provide the PowerPoint? Should we not provide the PowerPoint? Well, that's an excellent question. In order to increase engagement and for students to stay actively involved in the learning process, we want to create some information or provide some information to them regarding the PowerPoint. Some faculty choose to provide an outline, okay? At least that will give them information about content to get them started and writing down some of the content from the presentation. Some other faculty may choose to provide the entire PowerPoint. And now the disadvantage with that is students may not pay attention, right, to what we're saying if they have the entire PowerPoint presentation in front of them. Some educators choose to provide the PowerPoint after the lecture has happened. So you have a couple of options. You just want to consider the level of engagement that's associated with each option, okay? And next, let's take a look at some of the advantages and disadvantages. First of all, lecturing is a time-efficient strategy for covering complex material. It also can trigger students and helping them understand some of their muddy points. Okay, so hopefully students complete that pre-class assignment, complete reading outside of the classroom or some other activity that we have assigned, and then they're coming to class with questions that they may have, and we're able to clarify muddy points that they have. Or perhaps, as I mentioned, we may trigger some muddy points. Maybe there was some content that they didn't think about or that they thought they fully comprehended until they showed up for our lecture. And then, of course, the disadvantage is that sometimes students can be presented with too much information and we don't have enough student engagement activities to stimulate the learning process. With our students, especially with our adult learners, we want to be a guide on the side, and some references even talk about us being a coach more so than a sage on the stage. Okay, so we want to engage in a lot of active learning strategies so our students can be active participants in their learning. Okay, so if you chose A for the thought-provoking question, you are correct. Developing learning experiences that build on previous experiences and learning really is the best strategy that we should incorporate with our adult learners. This thought-provoking question is aligned with active learning and engagement and Knoll's adult learning theory. You're going to reference chapter 16 as your primary source to better comprehend exactly what the advantages and disadvantages are when it comes to providing a lecture with our students. All right, so what's next for you? Fall series, we're excited to announce that those dates have finally been finalized, and you can find those over on our website. There's a link right here in the description that will give you all the information you need to know about our fall series. It will be recorded, and for those of you that are already part of our monthly boot camp, there's nothing else you need to do other than register, but there's no additional fee that you will have to present at checkout. And the 7-week study plan. Now, we've been talking about our 7-week study plan. I know some of you already have yours mapped out, so congratulations to you all. For those of you that haven't mapped out your 7-week study plan, don't delay another day. Listen, you all have worked so hard to get to this point, and we want to help you cross that finish line, just like more than 12 nurse educator colleagues have done within the past couple of weeks with our support. We're also hearing about some that were not successful, okay? And we have a service guarantee, in case you haven't heard, that we are here to support you until you are successful, no matter how long that takes, okay? So if you want more information, feel free to go ahead and head over to our website, drsellerseducate.com. And we also know that you all are getting a little bit anxious about the fall semester and all of the competing parties that you have, okay? Just know that we have some tips and some tricks to help you get through a very busy start of the fall semester in order for you to stay on track and not get discouraged. Okay, so again, reach out to us if you have any questions as you move forward. And until next time, we hope this information has been helpful, and we will look forward to seeing you in an upcoming program. Have a great week, everybody. Bye-bye.